to The Healthy You, a conversation with Dr. J. And I am Dr. J. Dr. Shirley E. Jones, MD, a board-certified family physician. Our episode today is titled, In Darker Seasons. Over my 25 plus years of practicing medicine, I have diagnosed and treated several cases of depression. A depression that surfaces annually around the same time when the time falls back. The days get shorter and the nights longer. In darker seasons. Let's talk about darker nights and seasonal depression. Today we'll discuss what SAD, S-A-D is, and examine some research on its causes and treatments and explore practical approaches to help you manage it, if you've ever heard of it. So as the seasons change and the nights grow longer, many people notice a dip in their mood and their energy levels. For some, this goes beyond a temporary slump and can turn into a form of depression called SAD, Seasonal Affective Disorder. So what is Seasonal Affective Disorder, SAD? The definition is SAD is a subtype of depression that typically occurs during the fall and winter months when the sunlight decreases. So did you know around 5% of U.S. adults experience SAD, but up to 20% may have experienced milder winter blues by the American Psychiatric Association. It actually is more common in regions that are further from the equator, like in the north, where there is an overcast the majority of the winter and fall months with a sunlight reduction. So who is affected in SAD? Did you know that it's 4 times more common in women than men? And it typically starts in early adulthood and can recur annually. So why do the darker nights cause the seasonal affective disorder? Well, sunlight is a major regulator of serotonin, and that's a neurotransmitter we have in our brain that's associated with our mood. So low light exposure can lead to reduced serotonin and contribute to depressive symptoms. It affects your circadian rhythm. That's your internal body clock that responds to light exposure. So darker days can shift this rhythm, leading to feelings of fatigue and irritability. It also affects your melatonin and sleep-wake cycles. Darkness produces melatonin release. Melatonin regulates your sleep and your sleepiness. So in people with SAD, their melatonin production is altered, and they're usually drowsy, excessively sleepy all the time. There was a study by Magnuson and Portonen in 2005 that found that people with SAD had lower levels of serotonin transporter activity in the winter months, which affects their mood regulation. So you ask me, Dr. Jones, what are some of the signs and symptoms of SAD? Well, they are persistent feelings of sadness or depressed mood, loss in interest in doing things, fatigued, low energy, excessive sleep, which is what we call hypersomnia, weight gain, and carbohydrate cravings that lead to dietary changes, always snacking, difficulty concentrating, social withdrawal, having a hibernating behavior, irritability, signs of hopelessness. There's a study in JAMA Psychiatry in 2004 that stated that SAD has similar characteristics to other depressive disorder, but differs in seasonality, with these symptoms disappear in the spring and summer. So how do you know and get diagnosed for SAD? Well, we diagnose these disorders by looking at the DSM-5. SAD is diagnosed when there is a recurring pattern of depressive episodes at the same time each year for at least 2 consecutive years. And the symptoms cannot be attributed to other mental health conditions or life events or stressors. We also have different tests that we can give you. One is the SPOC questionnaire, Seasonal Pattern Affective Questionnaire. It assesses your season patterns in mood and behavior. Then there's also the PHQ-9. It measures your depression severity. Did you know the diagnosis of SAD is often missed or delayed because it can resemble other types of depression? So awareness and clinical screening are key for early intervention. So what are some of the traditional treatments options for SAD? Light therapy. So how light therapy works is that you can buy a light box that mimics sunlight, and you typically do 20 to 30 minutes every morning. There was a meta-analysis that concluded this light therapy is effective for 70% of patients with SAD, and their symptoms often improved in 1 to 2 weeks. So how does light therapy work? I bet you already know. Light exposure helps reset your circadian rhythms and increases the production of serotonin. Medications we use are also your SSRIs like fluoxetine and sertraline, and they help maintain the elevated levels of serotonin in your brain to boost your mood and your energy. Studies have shown that SSRIs, along with light therapy, and combining the methods have added benefits for treatment of SAD. There are also treatments of cognitive behavior therapy for SAD. It's the same type of cognitive behavior therapy we use for depression, but it focuses on SAD, helping you to manage your negative thoughts and patterns and behaviors to cope with having a low mood. This is also highly effective and done during the winter months, in the winter season, to prevent it from happening the next year. So what can you do naturally? Because it's me, Dr. Jones. Natural and lifestyle is always best. Exercise. Regular exercise increases your endorphins and your serotonin, which boosts your mood and your energy. There was a study in 2007 that found that exercise was just as effective as antidepressant in treating mild to moderate depression. So if you're lacking sunlight, can you guess what else is important? Vitamin D supplementation. People with SAD have been known to have low levels of vitamin D, so taking vitamin D will help increase their vitamin D level and improve their mood and improve their energy. Also, diet and nutrition. Healthy eating, whole foods, particularly complex carbohydrates, because these help stabilize your blood sugar and your energy levels. Omega-3 fatty acids. These are foods that are high in omega-3s, like fish, have been linked to better mental health. Mindfulness and meditation. Mindful techniques to reduce your stress and improve your emotional resilience. Meditation has been shown to reduce symptoms of anxiety and depression. Many studies in JAMA Internal Medicine concluded that mindfulness-based therapy is moderately effective for improving symptoms of depression. Another thing you can do is aromatherapy. There's certain oils like lavender, citrus that help boost your mood and decrease your stress. So what are the benefits of the limitations of natural methods? Well, one thing, natural methods are accessible and complement traditional therapies. There are often fewer side effects than medications. Limitations, they may not provide immediate relief, particularly in moderate to severe cases, but natural remedies, they lack studies and they are best used in conjunction with the treatment plans. So what are the possible outcomes for those people that suffer from SAD? With treatment, many people experience significant improvement in their symptoms and maintain a higher quality of life during the winter and fall months. Without treatment, the symptoms will worsen, more severe depression, which can impact your relationships, your work, and your overall well-being. There is a relapse risk that occurs, of course, in the winter and fall, but if you do your behavior therapy and use your light therapy and your medication, you can prevent your recurrence. So let's think about it. I have a patient, we'll name her Sarah. She's a 32-year-old marketing professional that lives in Chicago. Each winter she gets fatigued, she doesn't want to go out and hang out, and she craves food. So her doctor recommended cognitive behavior therapy along with light therapy, regular morning walks, some vitamin D, and over time, Sarah's symptoms improved, allowing her to maintain her work performance and her personal life and relationships during the winter months. So did you know that there are coping tips for winter months? Even if you start to feel these symptoms, one of the coping tips is to maximize your daylight exposure. Get outside during the daylight hours, and that helps support your circadian rhythm. Brighten your inside environment. Use daylight stimulating bulbs, and consider getting a light box. Even if you don't have diagnosed SAD, stay active, stay connected to your community and your friends. Physical activity and social interaction are powerful mood boosters. Get a pet. Takeaways from today. SAD is a recognized seasonal depression tied to reduced sunlight in the winter. It's treatable through light therapy, medication, and lifestyle changes. And you can manage these symptoms in a proactive approach. Final thought. SAD is real, but it's manageable. With awareness and support, you can find effective ways to enjoy the colder months and maintain your mental well-being. Thanks for tuning in to our show. And I'm here to provide you with information about various health topics. Some that you may have heard of, some that you may not have heard of. But as a medical doctor, it is my duty, my purpose, to provide you with medical information so you can make knowledgeable, healthy choices about your health to become the healthy you. Please like and share and subscribe and send this to some of your loved ones. If there are any topics you would like to have me discuss on our show, send me an email at drj@drj.info. If you want to get some of the objects we talk about on the show and the products, you can purchase them on my website, askdrj.info. Peace. Have a great day.